from Sydney, and a very sincere thank you to the organising committee for the privilege of speaking with you today. So I've been asked to talk about the impact of raising awareness through politicians and community leaders, and to be honest, we have done little or nothing with community leaders to date, so I'll concentrate my comments on talking about political advocacy. What I'd like to do is take you through a brief history of JAFA, which was established as a national charity in December 2019, so we're heading to our third birthday. Talk a little bit about our strategy and some of our achievements, which include a parliamentary inquiry into paediatric rheumatology services and leveraging substantial government funds for research into juvenile arthritis. And then we'll talk a little bit about where we're up to now and where to next. So some of the challenges that we've faced along the way, I guess you would all identify with funding as a major challenge, particularly in the time of COVID. We have a very small team of a wonderful half-time CEO and a 4-day-a-week technical project officer. And I work pretty much full-time as a volunteer, and because of the lack of staff, board members spend a lot of hours on juvenile arthritis JAFA business. And I guess the main challenge with this is to be operating effectively, even though on a shoestring, and that means that we need to keep paying particular attention to our governance and internal processes and procedures so that nothing falls between the cracks. So despite the challenges, we think we have a very good recipe. We have a compelling Cinderella story of a serious childhood disease that has been left way behind its equally serious and prevalent counterparts. We have a very strong and credible board with excellent pro bono support from one of our leading law firms and one of our leading accounting firms. We have a very strong political champion in Dr. Mike Friedlander, whom I'll speak about again later on, and a supportive and expert medical panel and service providers, and we work very, very closely with the Australian Paediatric Rheumatology Group and the uveitis specialists. We're fortunate to have in-house knowledge of and contacts within our Australian health system, and along the way we've had a lot of very good friends help us and a lot of luck. So just to start at the very beginning, and for us the very beginning was when our granddaughter was diagnosed with polyarticular JIA 4 years ago at the age of 6. And Stephen, my partner in life and crime, and I have both worked in the Australian health system for a professional lifetime. He's a medical specialist in diabetes and an academic, and I'm a retired public health academic, and I've worked in some of our state health departments and also in clinical services. And so we know exactly what services for a serious chronic childhood disease should look like. And so what we expected to see when our granddaughter was diagnosed was multidisciplinary juvenile arthritis centres at all major children's teaching hospitals, with outreach services to rural families providing expert clinical care, patient education, behaviour modification and support. We expected to see an active national juvenile arthritis research program and an active awareness campaign or campaigns. However, what we actually saw was quite different. And although they were extremely highly skilled and dedicated, there were only a tiny handful of paediatric rheumatologists and specialist nurses, with probably around 10 full-time equivalent paediatric rheumatologists for the whole of Australia, which is a population of 25 million people overall, and consequently, and just a handful of specialist nurses. And so there were virtually no truly multidisciplinary teams or outreach services or transition services, minimal data, in fact no really accurate data on prevalence, incidence and outcomes, but an estimated 6,000 to 10,000 children with arthritis and related rheumatic diseases. Minimal research in progress and little research capacity because the paediatric rheumatologists are just totally stretched, seeing patients all the time and don't have time for anything else. With the exception of Zoe's Angels, our existing patient organisations were largely focused on the 4 million adults, Australians, who have arthritis, but in all fairness, they were also providing some very good direct services in the way of kids camps, hotlines for parents and printed materials and schools resources. However, overall, the services for juvenile arthritis when our granddaughter was diagnosed were just exactly like the services for kids with diabetes diabetes were 40 years ago, and I mean 40 years. So we immediately set about lobbying our health minister in New South Wales, so that's my home state, and it's also the state with the worst ratio of paediatric rheumatologists to patients. We did meet with some success and get an increase in paediatric rheumatology time, and we were still going back to continuing on working on that now. But we very quickly realised that although we could lobby on a state-by-state basis, that unless we took a national approach, nothing was going to change. So we decided that JAFA's chief focus and approach should be on political advocacy at a national level, working towards health system changes across the country, and we've been working on that for the last 18 or 20 months. So we also decided around this time that we needed to have some structure and strategy to support our advocacy. So after talking about who we were and why we were there, we documented this plan on a page to stop pain, with our mission to stop pain and disability in kids with arthritis, and to do this through 3 main points, which are to improve diagnosis, care and support, increase awareness and advocacy, and build influence for research and programs. And that included building a broad-based grassroots JAFA community and looking to find high net worth individuals and corporates who would support our priority programs and research. So armed with all of this, we marched to Parliament House, our Federal Parliament House, on Word Day 2021 to hold an event which was sponsored by 2 former paediatricians turned members of Parliament, Dr. Mike Friedlander and Dr. Katie Allen, and we thank you very much for Word Day. It was a wonderful reason to hold an event in Parliament House. We were restricted by COVID limitations. We only have around 25 people, so we had 10 politicians, a few of our leading paediatric rheumatologists, some board members and parents, and 5 beautiful children who spoke very briefly but very eloquently and with great dignity about the aspects of their daily lives with juvenile arthritis, and of course won the hearts of the politicians. Now, we didn't realise it at the time, but this delightful young woman in the centre of this picture, Dr. Rishika, was probably the most important guest at the event. She's pictured here with Stephen, my better half, on the left, and Victoria Allen JAFA's inaugural chair on the right. And the story behind this is that Rishika comes from our Government Medical Research Futures Fund, which is a very rich fund of $20 billion. And the story is that Stephen and I had been trying to get an appointment with the then Health Minister, for months, who steadfastly refused to meet with us. And we thought this was a bit odd because Stephen's on his Inner Circle Diabetes Advisory Committee, and I've met him 2 or 3 times before for different reasons. However, I think the poor man was just so overwhelmed with what COVID was doing to our health system that he didn't want to meet with anyone who was going to be asking for money. And he did have this lovely $20 billion research fund. And so in October last year, he announced a call for grant applications for $21 million worth of research grants for juvenile arthritis and childhood musculoskeletal conditions, labelling them emerging health priorities, which was music to our ears. And those grants, the successful research group were awarded their grants in April this year, just not long before our federal election. The 2 of the greatest interest to juvenile arthritis of those grants are one which will look at earlier diagnosis and personalised medicine in relation to biologics, and the other is a wonderful national data linkage project which will, in a couple of years, start to answer some of the questions that we have about what happens to our kids in terms of their treatment and their hospitalisations and their joint injections and their biologics and their uveitis, and indeed will even be able to tell us about educational attainment. So this was a major breakthrough, the first ever substantial grants in Australia for juvenile arthritis, and the paediatric rheumatology community and JAFA are totally over the moon about this. So to continue with the advocacy, so go back to Dr. Mike Friedlander, our champion MP. So Mike's party won the election in in May, and it's the Australian Labor Party, and they're now in power. But at this time, Mike was in opposition, and he was the deputy chair of our Parliamentary Standing Committee on Health. And so we lobbied Mike very heavily and supported that lobbying with advocacy from parents writing to their MPs and to the Health Minister, lobbying for a parliamentary inquiry into paediatric rheumatology services. And so in December 2021, the parliamentary inquiry, well, actually it was called the Parliamentary Inquiry into Childhood Rheumatic Diseases, was announced. Submission closed in February this year, and the recommendations from the inquiry, from the 127 submissions and hearings of verbal evidence, were tabled in Parliament in March of this year. So this was probably the fastest ever parliamentary inquiry in Australia for any reason, and that I think was because the committee was determined to get their recommendations in before the government closed down for the election, and they did indeed do that and had 15 recommendations. Probably the first 5 of which focused around the workforce, with the main recommendation being to triple the Australian paediatric rheumatology workforce by 2030, and that includes nurses, specialist nurses, OTs, physios, psychologists, dietitians and so on, in addition to paediatric rheumatologists. Better access to biologics, better access to social support and affordable services, earlier diagnosis, awareness in schools. In fact, all the things that JAFA and the Australian Paediatric Rheumatology Group had asked for in our submissions to the inquiry. So we're very happy with this, and we understand that the new government is preparing to table its response to the recommendations. That probably will not happen, given the schedule they're working to at the moment, until early next year. But we are very happy with this process, and it's right on track. And so with this taken care of, we went back to working on our pre-election campaign, which we had started around September. Which we had started around September 2021. And we had developed a pre-election proposal with, it's really a funding proposal with some priority asks. We had identified and were activating parent advocates to meet with or write to the local MPs to ask them to support the asks, and we had developed a lobbying pack with tools and templates and tips to assist our parent advocates to do their job as effectively as possible. So when one of these proposals comes to the ministers, they flick it to the health bureaucrats. So we wanted a nice framework that would appeal to the public health mind. So we went for awareness, access and evidence. And we requested $10 million over 3 years, which is not a huge amount of money in the scheme of things, for a GP awareness early diagnosis program, a national schools program that would increase access to education and ensure that no child with arthritis was left behind or discriminated against, and ask for generating evidence through a national registry and the collection of baseline information. Now, we worked incredibly hard for this, and our patient advocates worked very, very hard for it as well. And unfortunately, neither the government nor the opposition made any commitment to funding these priority areas, even though they are totally consistent with the parliamentary inquiry recommendations. So this was a great disappointment, but our pre-election asks and our post-election asks, and we have a meeting scheduled with the new health minister to discuss this shortly, and hope that we may have some gains out of that. And in time, another door opened for us, and this was by a very chance invitation that I had to a function where I met the Prime Minister, and knowing that he had his mother had rheumatoid arthritis, asked him if he would help us raise awareness of juvenile arthritis. And just last week we were notified that the Prime Minister has scheduled an awareness-raising afternoon tea party for children with arthritis for November the 25th at the Prime Minister's residence in Canberra. So we're totally over the moon about this. It sends a strong community awareness message and also a message to his health ministers that he means business, and so do we, and we will be working very hard to ensure that we maximise the benefits of this Tea Party and that the recommendations of the inquiry are implemented into the future. So I'll leave it there, and thank you very much for your attention, and I'm very happy to be contacted should anyone wish to have a conversation. Thank you very much again to the committee for the invitation to speak.